Hello, and welcome to today's webinar on providing youth-friendly services presented by Connect, the Spartanburg School District Consortium, and Advocates for Youth. Thank you for joining us. Please note that this presentation is funded by the Centers for Disease Control and Prevention. Its contents are solely the responsibility of the authors and do not necessarily represent the official views or endorsement of the CDC or the Department of Health and Human Services. The Spartanburg School District Consortium has a 5-year cooperative agreement with the CDC to work on strategies to improve school-based adolescent health. We receive training and technical assistance from national partners, such as Advocates for Youth in Washington, D.C.
Hi everyone, my name is Caitlin Pecora and I'm from Advocates for Youth. And so to ground you a little bit in what Advocates for Youth does, Advocates for Youth partners with youth leaders, adult allies, and youth-serving organizations to advocate for policies and champion programs that recognize young people's rights to honest sexual health information, accessible, confidential, and affordable sexual health services, and the resources and opportunities necessary to create sexual health equity for all youth. Our values are reflected in the 3 R's. Youth have the inalienable right to honest sexual health information. Youth deserve respect. Society has the responsibility to provide young people with tools needed to safeguard their sexual health and lead the lives they desire. And we are so pleased to be partnering with Spartanburg to present this webinar. So I introduced myself very quickly, but just to give a little bit more background about our team, I am the program coordinator for Healthy and Supportive Schools. And so we partner with Spartanburg on the 1807 CDC cooperative agreement around sexual health education and sexual health services and providing technical assistance. I'm based in Washington, D.C., and I have over 5 years of experience in the field, and I've been at Advocates for just about a year. And I also want to shout out my colleague, Mary Beth Shidwutsky. She is our wonderful Associate Director of Healthy and Supportive Schools, and she has contributed a great amount to this webinar.
And here in Spartanburg, our team consists of Polly Edwards-Paget, who has recently transitioned from the Mary Black Foundation to the Spartanburg Regional Foundation, and she's been working with the Connect initiative since 2015. And my name is Lucy Wilms, and I'm the Adolescent Health Grant Manager for the Spartanburg School District Consortium, which includes Districts 1, 2, 3, and 7. Today's learning objectives include the following. We're going to identify the barriers that young people may face in accessing sexual health services, list the best practices of youth-friendly services, and implement at least one best practice to make services more youth-friendly. But before we begin, we want to make sure that all of our school nurses are familiar with Connect, which is the Adolescent Health Initiative for Spartanburg County. Connect's goal is positive youth outcomes for all adolescents. The website, connectspartanburg.org, serves as the one-stop shop for local resources for teens and their parents, as well as the partners who serve them. Connect collaborates with local adolescent serving agencies to build capacity in adolescent-friendly services and implement evidence-based interventions. Through these efforts, Connect brings awareness of adolescent issues and breaks down barriers to address the needs of youth. Connect seeks to improve the outcomes for our most valuable resource, our teens. Connect works with a broad range of partners in order to build capacity to impact teen health outcomes and ensure integrated systems of adolescent-friendly services, supports, and opportunities for youth. Connect grew out of a need to address the rates of teen pregnancy in Spartanburg. A little over 10 years ago, the teen birth rates in our county were much higher than both the state and national averages. And thanks to community interventions backed by local and federal funding, teen birth rates have declined 66% and even fell below the state average last year. There's a lot to understand about why and how this decline happened, but one of the key takeaways is that sexual health prevention is most effective when approached from a holistic perspective and considers what we call the whole child.
So the whole school, whole community, whole child model was developed in collaboration location and addressing the same related issues. These professionals have recognized the connection between health and academic achievement. A child who is not healthy might struggle with school, and a child who struggles to maintain their education will struggle to be healthy now and in the future. By developing a model that does not divide the needs of a child, but addresses both health and education with a surrounding support system of community, will help advance the well-being and education of students. One of the 10 components of the WSCC or WISC model is health services, which supports the connection of school staff, students, families, community, and healthcare providers to promote the healthcare of students in a healthy and safe school environment. Helping young people know what services they can access can assist with early intervention of potential health problems, can support preventative care, and wellness promotion. So I want to ground us in a definition of youth-friendly services, which is our topic for today. Youth-friendly services are services that encourage young people to come into the nurse's office for healthcare needs, address those needs, and create the experience in which young people want to come back for care. This means centering what young people need and not assuming that we as adults know what's best. So why is it important that services be youth-friendly? We certainly don't have to tell you all that nurses and health resource center staff have a crucial role in promoting students' health. From prevention, intervention, and case management, students depend daily on school health staff to get the care that they need. School nurses have an important and impactful role in the lives of young people in the promotion of health and safety, intervening with actual and potential health problems, providing case management services, and actively collaborating with others to build student capacity for adaptation, self-advocacy, and learning. We also want to acknowledge that the role of school nurse is even more important during the time of COVID-19 response. With added and frequently shifting responsibilities, we know that you're handling a lot right now. The goal in highlighting youth-friendly services is to make sure that the clinic environment and referral system are going to ensure that students get the care that they need. And when services are not youth-friendly, that can lead to students not wanting to get the care that they need. So by not feeling comfortable coming back for follow-up care, not taking medication, students can also feel that uncomfortableness with providing or with receiving care. So youth-friendly services ensure young people show up for services and then get the respectful care that they need and then come back. So we'll be going over some characteristics of what makes services youth-friendly. And we've divided it up into two groups. So that would be the physical environment and then the service offerings, as well as the provider behavior. So you can see these groupings on the slide here. So for physical environment, that encompasses a welcoming environment, integrated services, effective sexual health services, and services that are accessible. For provider behavior, that encompasses respectful and culturally competent care and confidential care. So we'll be going over each one of these more in depth throughout the webinar using the case studies to demonstrate. So here's our first case study. LJ is a 17-year-old student at your high school. She's a new student and has never been to the nurse's office before. She's had a bad experience with a nurse at her last school, so she's been hesitant to come in. She wants more information on sexual orientation, but she's nervous about asking. So let's take a moment and think about some of the barriers that LJ might face. Some of the barriers are she might not know where the nurse office is because she's new. She might not feel comfortable in the nurse's office based on her past experience. And she might not ask the nurse the questions that she needs to. So thinking about LJ's experience, one of her concerns was that she wouldn't feel comfortable in the clinic based on negative past experiences. Students should be comfortable as soon as they enter the clinic. So some questions to ask yourself. Is there comfortable seating? Are there posters that are reflective of the student population? Is there fun, engaging, colorful decorations? Is there take-home patient education materials? Staff are also part of this welcoming environment. So nurses should be welcoming students, being responsive, and being non-judgmental. So these are some considerations to really create this welcoming environment that would help LJ.
So if you would like some resources to help your office feel a little more welcoming, we do have materials available, including the Miners Bill of Rights posters, It's My Health posters, which you can see to your left, which let students know they can go to connectspartanburg.org for resources. We have sexual health referral cards that are very discreet for students, as well as rack cards for both parents and teens to talk about the services of Connect. They're very attractive and colorful. We do have cell phone charging stations that are available upon request. And if you would like any materials that we have with Connect, you can complete a materials request form at connectspartanburg.org or contact me directly. And please note, if you're in districts 1, 2, 3, or 7, you do have funding for these items. And so you can ask me if there's something specific that you would like to have in your office.
So let's move on to our next case study. AM is a 15-year-old student at your high school. She has recently started having sex with her boyfriend. She thinks she might want to start birth control, but she's worried about how much a visit might cost. She's also worried about feeling stigmatized about sexual activity and about confidentiality. And she'd also like to go to the clinic after school today. So she knows that there's a clinic that the nurse can refer her to, but again, she is worried about people finding out or that the clinician might make her feel bad for having sex with her boyfriend. And then she's also heard that the clinic might tell her parents if she goes there. So let's also think about some of these potential barriers in this case study for AM. This might be fear of her parents finding out. You definitely hear the need for privacy and confidentiality, a need for scheduling that fits her school schedule so she doesn't have to miss any school, a need for services that are free or reduced cost or that use her insurance and that can be done confidentially. And then also that need for culturally competent, respectful services.
So the characteristic that's demonstrated in AM's case study is an accessible physical environment for services. AM was worried about cost and wanted to go to the clinic after school today. Accessible services take into account hours. Does the clinic offer after school hours so students don't have to miss class? Location. Do all students know where the Health Resource Center is? Is it an easily accessible place? Cost. Do they offer free or low-cost services? Ease of scheduling. Are walk-in appointments acceptable? Transportation. Is the community clinic within walking distance or is it bus accessible? And advertising or student outreach. Are there announcements or posters or signs around the school? All the health services listed on the Connect website meet these criteria. And in fact, we've created a short video for teens that we're going to play about a minute of so you can see what it looks like. But this is directed towards teens who might be apprehensive about going to access services in our community. And this shows them what youth-friendly services look like. So in that short clip, you could see some of the concerns that a teen might have when going to a clinic. They're a little apprehensive about going, and just how reassuring it is when they get there that the atmosphere is warm and welcoming, that the services are confidential, and that really the services are really built around their needs. So if you want to see the rest of this video or you want to share it with your teens, go to connectspartanburg.org and you can watch the rest of it.
All right, so here is our next case study. JW is a 16-year-old student at your school. He comes into the school clinic for a sports physical so he can run track, but he has also several dental cavities that are causing pain. So he doesn't have a regular dentist or dental insurance. So thinking about some of those potential barriers for JW, really one of the main barriers in this case is that he doesn't have a dentist or dental insurance. So that leads us into integrated services.
So one of the potential barriers that we identified for JW is that he might have a dentist, and so he couldn't get the care he needs to address his cavities. This example shows the importance of connecting students to a range of services or integrated services. So integrated services address a wide range of healthcare needs. They include a strong referral system to other programs, including social services, and they follow the appropriate screening and health maintenance guidelines. District 7 has developed a very useful resource and referral guide for school nurses. We are using this guide to develop a referral system for sexual health services in the consortium. Please contact me if you would like more information about this resource. We'll be sharing what we're doing with this resource in future trainings.
So our next case study is SG. SG is a 16-year-old student at your high school. She's sexually active and has been using oral contraceptive pills for 1 year. She has a new sexual partner, and she's interested in learning about an IUD option so she doesn't have to keep track of her pills. So thinking about some potential barriers for SG, she definitely needs more information about birth control options. She would also need transportation to a clinic to obtain the IUD or another birth control option. And then she also needs that privacy and confidentiality.
So SG's case demonstrates a need for effective sexual health services. This includes screening and counseling all teens about sexual health. Many healthcare providers now recommend including one key question in all medical visits. This question asks, do you want to become pregnant in the next year? And offers counseling based upon their answer. Effective services provide information on a broad range of contraceptive options and referrals to STI counseling, testing, and treatment. You can find more information about contraceptive options for youth in Spartanburg at nodrama.org, and hear from Choose Well about person-centered reproductive health counseling at the Adolescent Health Conference, which will also be recorded and housed on the Connect website under Partner Resources.
So our next case example is TF. TF is a 17-year-old student at your high school. She identifies as a transgender girl. She asks you to call her by a name that is different than what is on her school record. And she comes into the clinic asking about where she can get tested for STIs. So let's think about what are some potential barriers that TF might face in accessing care. Some of these potential barriers might be the need for services that are respectful of her gender identity, that her school record and preferred name, there are discrepancies within those, need for privacy and confidentiality, and then she might not have transportation to the clinic where she can receive her STI tests. Mm-hmm. So this kind of goes into what the importance of provider behavior for youth-friendly services. So it's really important that for nurses and providers that they're providing respectful and culturally competent care. So this is a really key component to youth-friendly services. And as healthcare providers and nurses, it's important to understand adolescent development. So this is a time when adolescents are developing decision-making and risk reduction skills. So it's important to guide them on that journey rather than shaming them for any decisions that they might make. The clinic should be an environment where all students feel safe and supported. So that might mean pursuing staff training for working with specific populations of youth, such as immigrants and refugees, Muslim youth, LGBTQ youth, and other types of youth. So this leads us into the concept of being an askable adult. Providing respectful and culturally competent services mean that your interactions with young people need to make them feel comfortable to ask questions and seek support. And so this concept is called being an askable adult. So how does one be an askable adult? So an askable adult will convey warmth through body language, use a non-judgmental tone of voice, ask open-ended questions, practice active and reflective listening, do not make assumptions, give affirmations, don't deny, criticize, or shame, and then make sure the conversation focuses on the adolescent. It might be easy to get caught up telling stories about your own experience, but we also really want to focus on the young person's experience that's coming in for care. And additionally, an askable adult provides clear information rather than opinions. So we also wanted to touch on LGBTQ affirming services. So I'm going to read the importance of LGBTQ affirming services. Affirming health education and services help youth understand gender identity and sexual orientation with age-appropriate and medically accurate information, incorporate positive examples of LGBTQ individuals, romantic relationships, and families, emphasize the need for protection during sex for people of all identities, and dispel common myths and stereotypes about behavior identities. So this is what inclusive and affirming education and services can do to support young people and their sexual health.
And in order to be inclusive, it's important to display that the clinic is a safe space for LGBT students. Staff may also seek out additional training on ways to make their clinic inclusive of LGBT youth. Having educational materials in the waiting room that are specific to the needs of LGBT people and include local Spartanburg resources such as the Uplift Outreach Center, PFLAG, and Pride Link. The Connect website has resources about how you can start a GSA or Genders and Sexualities Alliance at your school.
So then we have the case example of RS. RS is a 15-year-old student at your high school. He comes into your office because his girlfriend tested positive for chlamydia and he's not sure what that means for him. His mother is on staff of a neighboring high school and knows the nursing staff at this current high school. So what are some potential barriers that RS might face in accessing care in this case example? So one might be his fear of his mom finding out that he has requested information around chlamydia, and he also needs those confidential services. And then you also heard that he was really uncertain about his STI status because his girlfriend tested positive for chlamydia, but he wasn't sure what that meant for him. So this leads us into the importance of confidential care. So it's really important that the teen's perceptions about confidentiality that they perceive that the visit is actually confidential. So they won't come for any care if they don't think it's confidential, even if it actually is. So it's really important that you communicate that to your young people that you're working with. So part of that can be posting confidentiality policies and students' rights in visible locations, and then discussing it with your patients and your students. And then ensuring all teachers and school staff are familiar with confidential care policies. So you as nurses, of course, know the confidentiality policies, but it's also important that the rest of the school be on the same page with it. And then for more information on confidential services, please see the Minors' Rights webinar. So in conclusion, youth-friendly services are welcoming to all teens, accessible, integrated within a system of care, able to provide referrals and information on quality sexual and reproductive health services, respectful and culturally competent with a wide range of teens, and confidential.
So the next steps you can take after this webinar, make sure you know your district's policies and inform other building level staff so that you're acting within the guidelines for your school. You can reach out to me, Lucy Wilms, on how to create a welcoming space. And there's my email address right there. And I will help coordinate with you to get some materials into your nurse's office. And also, you can make sure you know minors' rights and accessing care. We have a webinar that's available at Connect Spartanburg's YouTube channel and also available on the Connect Spartanburg Partner Resources page under Trainings. And here's a list of resources if you would like more information about providing youth-friendly services. Contact me if you would like these emailed directly to you. Please take a few minutes to complete the training evaluation. If you bring the camera feature up on your smartphone and hovered over the QR code, the SurveyMonkey will pop right up, and we would love to hear your feedback on this session. Thank you so much for your time and attention, and we hope that this information will help you provide youth-friendly services for your students.